The one thing that frustrated me was that I am the limiting factor when it comes to giving care to the patients, because I hit a limit at 20, 25 people. I cannot take care of 100 people or 1,000 people, because there's not only so much I can do, right? So I was always looking for ways how to scale
your performance.
Yeah, the performance and the access to the medical expertise that we doctors and many other medical professionals have. And I was convinced that technology can be an answer to make that access to healthcare more scalable.
Өнөөдрийн подкастыг үргэлжлүүлэн үзэхээс өмнө би таныг манай багийн гишүүн болохыг урьж байна. Юу хийх вэ гэхээр манай YouTube сувгт subscribe дараарай. Ингэснээр та бидний бэлтгэж байгаа мэдээллүүдийг авахын хажуугаар таны амьдралын хэм маягт шаардлагатай өөрчлөлтүүдийг бид нар өгөх тэр хэмжээний мэдээллийг өгөх болно. Тэгээд комент бичгээ бити мартаарай. Учир нь манай багийнхан бид бүгдийг нь уншиж үзээд санаа сэтгэлийг чинь авдаг гэсэн үг. Тэгэхээр өөрт авсан мэдээлэлээ өөртөө үлдээхгүйгээр бусдтайгаа бас шеэр хийгээрэй. За ингээ үргэлжлүүлээд ярьцлага үзье. Би өглөөгөө нэг сайхан кофегоо уугаал. Тэгээ өнөөдөр болох зүйлийг яг болцсон юм шиг бодгол хамгийн түрүүний хийх ёстой зүйл. Өглөө босонгуудаа шууд уцаа оролдохгүйгээр хамгийн эхлээд өнөөдөр ямар сайхан өглөө гэдгээ мэдрэхийн тулд хажууд байгаа зүйлсээ яг гоё болж байгаа юм шиг, яг гоё сайхан байгаа юм шигээр би төсөөлчдөг байна. Wow!
Amigo, Alter!
Okay. Wow!
I'm an ENT doctor. I go run more faster with that.
What do you feel for a difference?
Yes, it's feel the hair
Example for which patient you would recommend this?
snoring. So
Yeah.
I think I help in this
Yeah.
kind of problems.
Also ich empfehle das Noson grundsätzlich den Patienten, die halt einfach nachts darüber klagen, dass sie keine Luft bekommen, aber keine Lust haben, sich operieren zu lassen.
Okay.
Es gibt ja ähnliche Devices oder so, aber ich finde das Noson ist gut verarbeitet, es sitzt schön in der Nase.
Ja.
Und ich mag es, dass es von oben kommt.
Ja.
Weil es gibt ja auch die anderen, die von unten kommen.
Ja.
Ich finde es cool, wenn das von oben kommt. Weil es sitzt gut drin, fällt nicht raus und so.
Oh yeah.
Yeah, it's really...
Would you like use it for sports or sleeping, or how would you use it?
Yeah, I think for sport for sure, but maybe for sleeping as well. Because yeah.
Min guy, still show you. Wow. 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 That's it. Mein Gott.
Jetzt weißt du es, ja?
12. Ich kann endlich halten, bro.
So, ladies and gentlemen, good day, everyone. So, today's episode will be in English because we do have very special guest. Comes from Germany, and he brought a very, very, very high tech into our society, and we need to find out what. And this person is very a broad field of study he have done. He's a doctorate, a medical doctor and scientist, entrepreneur. He's recognized for his expertise in convergence of artificial intelligence, which is this AI thing is all over the world, and data and healthcare. So healthcare, AI with the healthcare, that's what we're gonna focus on more on today, which we always try to bring the health issues and solutions for those diseases and all those problems. We always try to do that. And plus, he holds the medical doctorate in neuroscience from Ludwig Maximilian University of Munich and Harvard Medical School. He done an MBA from Munich Business School also, and a master's degree in data science from also the Munich LMU University. So, the Mr. is gone away because he's a doctorate. So, Dr. Franz Pfister, welcome to Mongolia.
Thank you so much for this warm welcome. I'm pleased to be here.
And welcome to our podcast. Yeah, so because of you have done this doctorate on neuroscience and master degrees in all those fields, I want to know why you started studying neuroscience first.
So actually I studied medicine, right? And as things evolved, like I got really interested in the brain because it identifies us as humans. It makes us think, it makes us experience things, and it makes us create new things. And that led me to neuroscience, and eventually like the doctorate I did in neuroscience, where we were looking at the brain and the connections and how neurons work with each other. And eventually the next stage was AI. So yeah, very exciting topics.
So next stage is AI. That's what you said just now. How do you see AI will help on your field? What kind of solutions, what kind of innovations will bring when you're using AI on neuroscience?
Yeah. So when we look at the broader field of healthcare, not only neuroscience, but healthcare in general, it's something that touches every single one of us, right? So there is not any human being that is not having an interface with medicine and healthcare. But then at the same time, access to health in general is not very easy for everybody in the world. It's not very equal for everybody in the world. And it should be accessible for everybody in the world. So what I believe is that technology can really help us make access easy, scalable, and equitable for everybody. And that's what I find really exciting. And AI is going to play a big role in that.
We found out that you created a company called Deepc. So about Deepc, how you see Deepc by the time right now? First, give me an answer for that. And I want to know how you see your company in the future. Not the product and service wise, but the solution, innovation side wise.
Yeah. So today we are focusing on a very niche vertical of healthcare, which is radiology. So medical imaging. Think about X-ray imaging or CT or MRI imaging, mammography. And what we do with Deepc is we have a platform which integrates all different AI algorithms that would help analyze those images and support doctors in their everyday workflow, making the radiology reporting easier, faster, provide higher quality of reading. That's what we do today with Deepc. We have many great partners that we are working with, local partners, global partners. Also, we have a great partner here in Mongolia that we are working closely together with, the Digital Medical Center. And what we will do going forward is not stay only in radiology, but expand to other verticals of healthcare. So there is so much we can do. So for example, in diagnostics alone, there is other areas like laboratory medicine, genetic medicine, etc., etc., and we will expand to many other verticals over time. So the end, yeah.
Before we moving on, I would like to have a little bit more on supporting doctors. Right. Elaborate more on that, because I want to give this knowledge into my audience.
Yeah. Sure.
Yeah.
So look, today.
With example.
Yeah. So today doctors are, they're great. They work on two main streams. One is a very data-driven stream. It's about capturing data from the patients, asking their past medical history, doing examinations, doing some diagnostic tests like imaging. And then that's one stream of work. And then the other one is really caring for the patients and making sure that patients are on board of the journey and are getting the care that they deserve.
Yeah.
So on that first part, on the diagnostic part, where they are very data-driven and make a lot of decisions, we see that the workload simply increases. And why is that? Because more and more and more data is getting available. So the accessibility of imaging, for example, is getting much better, but the data that is generated is increased 10% per year. So if you think about it, that means over 10 years, the amount of work that a doctor needs to do has more than doubled, but they are not getting more in terms of the workforce. So it means you need to do double the work in the same amount of time. And that can lead to a lot of downstream problems. Doctors could feel burned out, simply overwhelmed by the amount of work. And if you need to do the same amount of, the double amount of work in the same amount of time, what will happen naturally? Not only in medicine, but generally speaking, you could make errors, you could make mistakes. And this is what we want to avoid, of course. So how do we support doctors using AI is actually creating kind of a safety net for them. It's the doctor looking at the images, but then the AI is looking at the images in the background and checking that there are no mistakes happening and keeping the quality high. And that's how we support them at the same time getting more efficient, faster in the reading. And eventually, it's all about the patients and that we give the care to the patients that they deserve, as I said before.
So I would like to have a small explanation on how AI works and what data AI analyzes in order to give this diagnosis into doctor's hand. So there will be difference between the data that analyzing maybe would be European or I don't know, Western side people. There will be difference between Mongolians and all those general data that you guys have.
Yes. So, and that's a very, very important point, right? AI is basically based on data. So when you build AI, you are actually training algorithms by looking at millions of different data samples. And as you rightfully said, this database should be very diverse. It should not only be based on European people. It should also not only be based on Asian people. It should be like a huge variety of different data samples, such that you don't have inequalities in the database. Because once an algorithm is developed, it will look at new data, and we expect AI to actually work on any type of new data. So making sure that the variability of different types of people, different types of machines, different types of data is captured appropriately in the first place is very important. Now, when we look at the types of data that AI is processing today in the field of radiology, it's imaging data. So think about X-ray data, for example. Typical examination would be like fracture detection, or it would be chest X-ray reading for the detection of different lung diseases, for example. And when we look at AI, those algorithms have been trained to detect fractures, lung diseases of any types and shapes and forms. So when AI is analyzing this data, it actually ingests new data, then analyzes it and gives like an output what AI has found. It could also be that AI says that data looks normal. And this is really helpful for doctors in their interpretation of those images. because it can give them this reassurance that their diagnosis is right.
Mm-hmm. So when Deepc comes to Mongolian society, what kind of impact do you expect?
Huge impact. Let me elaborate on that a little bit more in detail. So in Mongolia, as in almost every other country in the world, imaging is a very important cornerstone of diagnostics and medicine in general. Imagine like almost every patient story, like every clinical pathway includes imaging. More than 90%. So when you think about it, it's a very, very important discipline of medicine, looking at medical images. I give you a few examples. For example, in cancer detection, or in trauma care, or in critically ill patients, for example, in stroke. In most of those cases, you will do a medical imaging examination. You do a CT of the head, you do a mammogram of the breast, you do an X-ray of the chest. So as I described before, there is a shortage of expertise of radiologists, experts that look at those images. And that's not a Mongolian challenge, it's a global challenge. Like when you look at the UK, for example, there's a shortage of radiologists of thousands of people. So there, what is the result of that is very long waiting times to get actually the result of the imaging. It can be weeks or even up to months. And at the same time, the radiologists are very over challenged, overburdened with this amount of work, which creates like those backlogs of work. So that can create a lot of issues. When you think about it, we have the image ready, but you're waiting for the actual result for weeks. There's a lot that can happen in those weeks. The patient could have a condition that gets worse. So reducing those waiting times is very important for patients and giving them the care that they need. But then at the same time, making sure that backlogs are cleared and doctors can actually have much more time to care for their patients is also a very important factor. So now when we look at Mongolia and how AI can actually change healthcare and have an impact on healthcare, is what we are planning to do is roll out AI in the major centers, but also in the more remote areas of the country that maybe do not have access to experts in that field, and evening out inequalities and helping the patients getting access to the care with much less waiting time, such that treatments can be initiated much faster.
Hey, подкастын таалагдж байна уу? Үргэлжлүүлээд бүр илүү ихийг сонсохыг хүсэж байгаа бол биднийг дэмжээрэй. Бид Хандивын наастаа болсон байна. Тайлбар хэсэгт нь оруулсан байгаа. Эсвэл энийг хардаа. Баярлаа.
There's one more topic that I need to touch because it's for me it's too important. Personal information protection in AI and healthcare in general, it's issue, right?
Yep.
So when it comes to Mongolia, we do have people who does not give importance to protect their privacy. So because they don't know yet what's the importance of protecting their healthcare information. So can you explain the importance of that data privacy in healthcare first, and what's your solution on that?
It's a very, very good question, and it's a super important topic. So data privacy, especially with health data, is absolutely fundamental. And we are a German company, and in Germany, maybe we are focusing a little bit too much on privacy sometimes, but that also means that everything that we've built has like data privacy at its core. So what we are doing to ensure the privacy of patients is actually, before we process the images with the AI, we actually make sure that we remove all private information of patients. So that when the algorithm sees the data, it doesn't know who the patient is and any private information of the patient. And that's not needed, right? So we make sure that the algorithm analyzes the data and later on we match it again to the original data. And we have technological foundation for that and also like a process that would allow us to do that. And everything is designed with privacy in mind.
How do you see integration of a blockchain technology into this field? Is there any integration you have done or might want to do?
We haven't done it yet, but we've thought about it quite a bit. I believe that like decentralized technologies like blockchain can actually have a huge benefit in terms of traceability. There needs to be made a trade-off, right? So we need to make a trade-off in terms of traceability and documenting transactions, but then at the same time making sure that privacy is maintained. Where I see a huge potential for the application of blockchain technologies is actually the documentation of transactions in terms of like who saw the data of the patient and who processed the data of the patient. And this can actually, on the one hand, create transparency who access data, but not sabotaging the data privacy of patients at the same time. So actually adding an extra layer of security in terms of access control. And that's where I see a huge potential actually.
When I was reading your company's profile and then what capable of, but the capability says everything, but the solution side or the background side, I see it's an integration of many useful AI solutions on a platform, right?
Yep.
So how many integrations you have done? So there's a deep OS operating system that you guys created. That's what I understood. So can you explain more on that?
Absolutely. So with Deepc OS, which is our AI platform's name, we have already integrated more than 70 of those AI applications. That's a huge chunk of the global market. And then the huge benefit for health systems is we only need to do one installation. We have one contract with our customers, and they can access all of those applications at once. It's like an app store, if you will. So they don't need to have individual contracts with each and every point solution provider, but everything can flow through us. And that's a huge, huge benefit because we take care of everything. Yeah.
So because you said so, you think those 70 applications will increase in the future?
Absolutely. So currently we see around 1,000 applications in the global market that are available. On the one hand, we will onboard more of those. But when you look into the future, there will be many more applications for subspecialized analysis that we expect to hit the market. There is a lot of research applications under development that are expected to get to a product commercialization stage in the future. So by 2030, we're expecting 10,000 of solutions being available in the global market that we can then deliver to hospital systems to be in productive use.
Now, the most important topic for all those who watch this video is price. So how you see your price as compared to market size? I mean, when there's, I'm not sure about the similar products out there, but the price point in Mongolian market, do you think it can be accessible for general public?
Yeah, so we're working through that right now, making sure that we are meeting the price levels in this market to not make it only accessible to a few, but actually make it broadly accessible. It's a process we're currently in, but we're quite confident to converge to a point where we can actually make the technology accessible to the general population. Because what we want to, so one of our core values and actually our mission is making health, access to health scalable. And that means making it scalable for every person in the world. So it needs to happen not only on a technology level, although we are a technology company, but actually working with the different stakeholders to actually get to a point where those technologies are made available to all people in the population. So currently, the pricing model, how it works, is basically a per analysis model. So each analysis of the AI is getting charged for and in the best case reimbursed for. And that's where we are also working with governments and the Ministry of Health and other organizations, typically in the markets we operate in, to find like a suitable model that can scale as well.
Би өглөөгөө нэг сайхан кофегоо уугаал тэгээ өнөөдөр болох зүйлийг яг болцсон юм шиг бодгол хамгийн түрүүний хийх ёстой зүйл. Өглөө босонгуудаа шууд уцаа оролдохгүйгээр хамгийн эхлээд өнөөдөр ямар сайхан өглөө гэдгээ мэдрэхийн тулд хажууд байгаа зүйлсээ яг гоё болж байгаа юм шиг, яг гоё сайхан байгаа юм шигээр би төсөөлчдөг байна.
Wow! Amigo, Alter!
Okay. Wow.
I'm an ENT doctor. I go run more faster
Yeah.
with that.
What do you feel for a difference?
Yes, it's feel the hair
Example for which patient you would recommend this?
snoring. So
Yeah.
I think I help in this
Yeah.
kind of problems.
Also ich empfehle das nur so grundsätzlich den Patienten, die halt einfach nachts darüber klagen, dass sie keine Luft bekommen, aber keine Lust haben, sich operieren zu lassen.
Okay.
Gibt ja ähnliche Devices oder so, aber ich finde das Noson ist gut verarbeitet, es sitzt schön in der Nase
Ja.
und ich mag es, dass es von oben kommt.
Ja.
Weil es gibt
Ja.
ja auch die anderen, die von unten kommen.
Ja.
Ich finde es cool, wenn das von oben kommt. Es sitzt gut drin, fällt nicht raus und so.
Oh yeah. Yeah, it's really.
Would you like use it for sports or sleeping, or how would you use it?
Yeah, I think for sport for sure, but maybe for sleeping as well. Because yeah.
Minkä spyrshoja. Wow. Wow. That's it. Mein Gott. Jetzt weiß ich es. 12. Ich kann endlich halten, my bro.
Based on your answer, you've given me the importance of Deepc, what kind of benefit brings to doctors. And it is important to Mongolia because we have a very small population. 3.4 million people lives in this huge country. Half of them lives way far from the medical centers. And we need this kind of solution as soon as possible. But there's a big but. There's a big problem, which is the general public does not understand what kind of benefit Deepc provides to that person. So they need to understand first. And yeah, of course, the medical doctors and then all the medical professionals will understand easily. But the person who's hearing our conversation, I know the beauty of the AI solutions and stuff like that, but like, what's the difference between me going to a health care center who does not have this AI solution in between the place that have included this solution?
That's a great question. And that's like really at the center of everything, right? Because the reason why we are doing all of this is to provide better care for our patients. So I think I will answer the question with like a few examples to make it very tangible, right? So in many different areas of medicine, we could be so much better. And one example is emergency medicine. Let's talk about trauma care or stroke. A person having a stroke, every minute counts.
Yes.
So the stroke hits, you go to the hospital as soon as possible because the brain tissue is at risk. And so there's a saying in neurology, which is time is brain. So you want to make the diagnosis as quickly and as soon as possible to then initiate the treatment and resolve the clot, which is causing the stroke. The faster you are in this process, the more likely you are to actually secure as much brain tissue as possible. And in the best case, the person that has suffered a stroke doesn't have any long-term symptoms at all. But it's all about how fast we can actually make the diagnosis and then initiate the treatment. So that's the overarching goal, right? Mm-hmm. How does AI play a role in that pathway that I just outlined? So in many scenarios, there are inefficiencies and we lose time. And that can really be damaging for the patients because it might even be too late for the treatment. And the patient might then suffer from long-term sickness and needs long-term care by other people. So, for example, the time that we need to get to the confirmatory diagnosis, this needs to be minimized as much as possible. And that's where AI can really make a difference. By analyzing the images as quickly as possible in the background, looking at the different areas, and then giving immediate feedback to the doctors if there is a stroke and confirming the diagnosis, and then immediately initiating the treatment. So studies have shown that this whole period of time between starting of the stroke and initiating the treatment can be reduced with AI by 60 to 90 minutes. Oh. That can make a huge difference in terms of outcomes. It can mean if you are disabled for the rest of your life, or if you actually don't have any long-term problems. And this is like what we see as one of dozens of use cases where AI can make a real difference. And there are tons more, like in early cancer detection. It makes a huge difference if you are detecting cancer like years earlier and can maybe prevent it from breaking out and causing severe long-term affection of the patient or even death, to actually treating it very early and not having any problem downstream. And you can repeat that whole cycle depending on the clinical pathway over and over again. We talked about stroke, cancer, trauma care, emergency care, different types of cancer, etc. So I hope this illustrates a bit why we believe AI can make such a difference. But there is a second part of it. Okay. So we are mainly, when we think about like healthcare and AI and innovation and all of those great new technologies, we are thinking about like the top-notch lighthouse centers of the world that provide healthcare to people in large metropolitan cities where access to health is actually already at a very, very good level, right? And healthcare itself is at a very, very high level itself. But when we think about other areas of the country, which is often the huge majority, there are a huge inequalities if you compare it to like the cities. Even in countries like Germany, like the life expectancy in the countryside is 10 years lower than in the cities. Oh, imagine. This is crazy. Like people in the countryside don't have worse genes. They don't. But access to healthcare is much worse.
That's the difference.
That's a huge difference. And this we see in all countries in the world, that remote areas have less good access to healthcare. And that means that they don't experience the same level of care. And that eventually means that they might die younger. Mm-hmm. So this inequality, we believe in the long run, we can actually address with AI. Because in remote areas, doctors might not be overworked, they might simply not be there. So there might not be a radiologist, like an expert looking at the images. There might be a huge gap in terms of access to healthcare in more remote areas. And that's where we believe AI can really make a difference, by actually giving an accurate and timely diagnosis in the first place, and making access to expert opinions and diagnostic results available in the first place. And that actually can then lead to much better treatment downstream. So there are those two areas that we see, like of course, like an already highly developed access to care settings, like especially in cities, where AI can make a difference, of course, but also filling a huge gap in more remote areas where access to care isn't available today.
Okay, let's try time travel a little bit. Let's go back in
Back
time.
or forth.
Yeah, back and forth. So when you found the idea of creating Deepc,
Yeah.
and what was the reason, how you find the idea, including this AI and
It's very interesting. So it kind of goes back to my history as a doctor. So I was working in a hospital for a few years in the field of neurology. So that includes stroke patients, Parkinson's patients, multiple sclerosis patients. And I had my ward of 25 patients. I really liked working with patients and with the colleagues and the teams. But the one thing that frustrated me was that I am the limiting factor when it comes to giving care to the patients, because I hit a limit at 25 people. I cannot take care of
100 people.
100 people or 1,000 people,
Yes.
because there's not only so much I can do, right? So I was always looking for ways how to scale
Your performance.
the performance and the access to the medical expertise that we doctors and many other medical professionals have. And I was convinced that technology can be an answer to make that access to healthcare more scalable. It was back in 2014, 2015, so about 10 years ago, when I saw in the market more and more AI evidence that AI can actually be this technology, this core technology, to make healthcare much more scalable. It was very early days for AI. So, AI stems back from the 1950s, where first neural networks have been developed, and then there were like decision trees and clinical assistive systems. But modern AI only became possible with the accessibility to data, to compute power, which we all see now with companies like NVIDIA and GPUs being made much more accessible. And then at the same time, more advanced algorithms. So it's the convergence of those three: data, compute power, and algorithms that made this new generation of AI that we are also now seeing in the general public with ChatGPT and foundation models that made this possible. So back in 2014, 2015, we saw like the first front runners of those new technologies in medicine. And there were a couple of different areas, but radiology had always been one of the front runners. And it's very easy. Why? Because data is very broadly available. It's all digital. So this data could be used to actually train the first generation of those new AI models in the field of radiology. So how did I get into that field? So we were basically, my co-founder and I, we were looking at the field of radiology and how we could actually create impact and value in the field of radiology. And we were building our own AI algorithms. It was in 2018, roundabout, so a few years later. And once we had like the first algorithm available, together with our research partner, Technical University in Munich, we brought this into the clinical workflow to test it out. So what we have discovered during that process is that it's a very, very tedious process to get actually from an algorithm, which is very powerful, to a clinical implementation. It took us almost 1 year to actually get this up and running in the hospital. And why did it take us so long? So you mentioned data privacy. You need to set up all the processes and the systems in a way such that health data of patients is always safe and secure. You need to set up the information security processes and systems. You need to set up the deployment infrastructure accordingly. You need to make sure that the results of the AI are integrated deeply with the existing clinical workflows. You need to make sure that doctors are trained, that they know how the algorithm is working, etc. And there are many, many other different steps that need to be undertaken to get from an algorithm in the lab to actually an algorithm working in the real world clinical workflows. And it was this realization that an infrastructure for making AI real isn't there. It's simply not existing. So that was the point where we said, okay, why would we focus on building AI? There are many, many other companies and researchers that are probably much better than we are. Why don't we focus on building that infrastructure to enable all of those researchers to bring their AI into the clinical systems? And we shifted our focus from building AI to building infrastructure for AI.
Yes.
And that is basically, or that brings us back to my starting point, is like using technology to make access to healthcare really scalable. And that infrastructure is the scalability piece.
How many Asian countries approached you guys except Mongolia?
Many, actually. So we need to focus, of course, on like first countries, and then go step by step to other countries. But we have been actually engaging with a lot of different countries. The reason why we decided to start in Mongolia is, again, a very strong local partner. We strongly believe in partnerships, and we strongly believe that it is important to be operating as a global company, but have local representation. That's absolutely paramount and key. And with the Digital Medical Center here in Mongolia, we found a partner that not only understands technology very well, and understands like what the impact of those new technologies could be on the society, but also has very strong bonds and understanding of the local healthcare system, because every healthcare system and the requirements are different. And we couldn't do it ourselves. So we joined forces to bring these new technologies to the Mongolian society and healthcare system, leaning on their expertise and networks locally.
Do you remember what was the reaction when your mom and dad heard about this solution? How, for sure, you have explained to them what was AI bringing to the table.
Yeah, so I think they were always very curious about it. But of course, it took me a little bit of explanation to make sure they understand like what the impact of this is.
Was it hard for you to explain?
Not so hard, because they're both doctors, right? So they know a lot about the medical field. But of course, AI is very abstract, and the technology part, I had to explain a bit.
Yeah, for sure. That's for sure. So what, you know, up until now, it's proven what can AI do. But from this point on, for the future, what kind of envision do you see from healthcare perspective, combining or having an intimate relationship with AI? What kind of benefits or fear that we should have?
So it's a great question, and I think I need to disentangle a little bit. So I believe today we can replicate very well and support very well how we practice healthcare today. So AI can play a really good role to make healthcare faster. It can play a really important role to make access to healthcare better. It can play a really important role to relieve the healthcare staff and maintain a very high quality of care. In the future, I believe AI can be that transformational technology which opens up completely new horizons of healthcare. Not replicating in a safer, faster, better, and cheaper way what we do today, but actually helping us to actually go like beyond what we can do today. Detecting cancer earlier that we can't detect today because simply we can't see it with our eyes, but the machine might be able to see it much earlier. Or think about more personalized treatments. So today we are having certain disease categories, Parkinson's, stroke, breast cancer. But the reality is every human being is different. So there are different types of breast cancer by genetic profiles, by receptor status, by different characteristics of each and every human. So the problem today is we treat many diseases in a one-off approach. So if we have the same disease, we get the same treatment, but you and I, we are different individuals, right? We have different bodies, we have different types of features, and we might need actually a personalized different treatment. Today, many drugs are ineffective, and we accept the fact. So the most commonly used drugs in healthcare for asthma or hypertension, they aren't effective in more than 50% of people, simply because they are exhibiting features that don't match like the profile of the drug. So what I'm trying to allude to here is that AI will be able to help us understand much better the individual characteristics of each and every individual that help us understand what type of breast cancer someone has, what type of Parkinson's someone has, and what type of other disease someone has, in order to individualize the treatment and intervention and personalize medicine to each and every individual. And I think this is something we can't practice today because we simply don't have the data. We don't know enough about the individual person. But in the future, AI can help us get to that information. And that will be a true transformation because it makes healthcare personalized.
To achieve all the things that you have said, what kind of challenges we need to go through to reach out?
So there are a lot of things that we need to take care of course. So on the one hand, there are technology challenges to make things work, but that's technology. We will get there at some point. I'm not worried about that. It's an evolution, but we are like moving at a very, very fast pace. So let's not talk about the technology part. It's more about like the human part in the end. We are all humans in the end. And I think a very, very important factor that we need to take into consideration is that in healthcare, when we apply technology, it's not going to be a process which we switch on from one day to the other. It is a change process which includes like many different individuals to work together to make that change happen. So it's not only about the doctors, it's not only about the patients, it's about the general society. It includes the governments, it includes IT people, it includes like innovators, it includes entrepreneurs, it includes basically everybody to be part of that change process, understanding what the impact of those new technologies will be. And the impact might not only be the opportunities in making health better, but also there might be risks associated with it. So we need to really make sure that everybody is educated about like the pros and cons and how we use those technologies in a safe and responsible manner. And this whole change process, I think we need to take serious in order to make the change sustainable.
Dr. Franz, how many times you give diagnosis, general diagnosis for your own body for a year?
Probably I should go to the doctor more often. But it's a doctor's disease, right?
Yeah.
That medical doctors usually don't like to go to the doctor because they know better themselves. So I only
That's what they believe.
yeah, that's what they believe. It's a doctor's disease. I go to the doctor when I have to, but I'm envisioning a future where we are actually going from like treating patients and being reactive to actually a future where we are proactive and seeing issues before they actually turn into real problems and medical problems. And I'm actually very excited about me being part of that like future. And probably I should go to the doctor more often then.
Oh, these doctors. Everyone does the same thing, but all the time they talks about how to prevent and how going to a medical check for like several times a year and stuff like that. How do you see your life in one day? What do you do? So you exercise?
A bit. I should do more probably.
What do you do?
So I start the day with a coffee.
Би өглөөгөө нэг сайхан кофегоо уугаал тэгээ өнөөдөр болох зүйлийг яг болцсон юм шиг бодгол хамгийн дөрөвний хийх ёстой зүйл. Өглөө босонгуудаа шууд уцаа оролдохгүйгээр хамгийн эхлээд өнөөдөр ямар сайхан өглөө гэдгээ мэдрэхийн тулд хажууд байгаа зүйлсээ яг гоё болж байгаа юм шиг, яг гоё сайхан байгаа юм шигээр би төсөөлчдөг байна.
Wow! Amigo, Alter!
Okay. Wow.
I'm an ENT doctor. I go run more faster
Yeah?
with that.
What do you feel for a difference?
Yes, it's feel the hair
Example for which patient you would recommend this?
snoring. So
Yeah.
I think I help in this
Yeah.
kind of problems.
Also ich empfehle das nur so grundsätzlich den Patienten, die halt einfach nachts darüber klagen, dass sie keine Luft bekommen, aber keine Lust haben, sich operieren zu lassen. Es gibt ja ähnliche Devices oder so, aber ich finde das Noson ist gut verarbeitet, es sitzt schön in der Nase.
Ja.
Und ich mag es, dass es von oben kommt.
Ja.
Weil es gibt ja auch die anderen, die von unten kommen.
Ja.
Ich finde es cool, wenn das von oben kommt. Weil es sitzt gut drin, fällt nicht raus und so.
Oh yeah. Yeah, it's really.
Would you like use it for sports or sleeping, or how would you use it?
Yeah, I think for sport for sure, but maybe for sleeping as well. Because yeah.
Minkä spyrssoja. Wow. Wow. Mein Gott. Jetzt weiß ich es ja. 12. Ich kann endlich halten, my bro.
Ah, okay.
Yeah. No, I usually check my emails, like catching up. We are working in a global team, so there's always like somebody
differences,
ahead of me. Like Australia is already in the middle of the day.
Yeah.
And then it's catching up. Then catching up with the team. And then basically it's having meetings with people around the globe, like Zoom, in person, etc. Then working because we are like a global team. There's always somebody ahead of me and somebody behind me.
Yeah.
And making sure everything is coordinated and we reach our goals. And then, of course, there's the personal side. We need to exercise. We need to take care of ourselves. I personally really love to cook. And that's like the part of my day I'm looking forward to and spend quite some effort. And then it's going to bed and starting again.
Okay. So now I understand. You cook healthy in order to protect your body.
I try to.
That's your solution.
I try to.
Okay. It's been a pleasure to have you over here and talk about all the things we included in this interview. And I'm glad that we being one of the first countries that adapting Deepc into our society. And let's hope for the best. And thank you very much for bringing it.
Thank you so much for having me, Mandul. It was a great pleasure.
And wish you luck in everything that you wanted to achieve in the near future. And I'm hoping to see you again with a different topic.
Thank you.
Okay, thank you guys for staying up until now. And wish you happiness, as I always wish you. And see you next time.
За та биднийг хэрхэн дэмжихээ мэдэхгүй байгаа бол энэ хандивын данс руу мөнгө илгээхэд хангалттай. Гэхдээ их мөнгө биш. Та заавал аимшигтэй их мөнгө илгээх шаардлагагүй. Магадгүй 1000 төгрөг, 2000 төгрөг, 20000 төгрөг байсан ч болно. Гол нь бид та бүхний энэ үйлдэлээс маш хурам авдаг учраас цааш та хүргэж байгаа подкастынхаа чанарыг магадгүй олон улсын эрдэмтдтэй гадаадд очиж ярилцлага хийх гих зэрэг зүйлс бид нар зарцуулахыг хичээж байгаа. Тэгэхээр олон жил бид нар хийсэн энэ подкаста зогсоомооргүй байна, үргэлжлүүлмээр байна. Мөн амьдралын чанарыг дээшлүүлэхэд бид нар оролцоотой байхыг хүсэж байгаа юм шүү. Баярлалаа. Данс доор байгаа шүү. Баяртай.